Seniors' doctors are wrong about blood sugar, the truth. You're sitting in your doctor's office looking at your latest lab results, and your fasting blood sugar is 118 milligrams per deciliter. Your doctor's face shows concern. She tells you that normal fasting blood sugar should be under 100, that your number of 118 puts you in the prediabetes range, and that if you don't make changes, you're on the path to developing type 2 diabetes. She tells you to lose weight, exercise more, cut out sugar and carbohydrates. She might even suggest starting metformin to prevent diabetes from developing. You leave the office feeling anxious and defeated. Another health problem to worry about. Another medication you might need to take. Another failure to stay healthy as you age. But here's what your doctor didn't tell you. What she probably doesn't even know, because it's not taught in medical school, and it's buried in research that most practicing physicians never see. The blood sugar ranges that define normal prediabetes and diabetes were established decades ago, based on studies of young and middle-aged adults, not older adults. And emerging research over the past 5 years has revealed something shocking. What if I told you that research published just 11 weeks ago in the journal Diabetes Care followed 8,700 adults over 70 for 15 years and found that those with fasting blood sugar between 100 and 125, the prediabetes range, actually had lower mortality, better cognitive function, and fewer hospitalizations than those with fasting blood sugar under 100? What if I told you that the same study found that adults over 75 with fasting blood sugar in the 110 to 130 range, considered prediabetes or even mild diabetes by current standards, lived longer and stayed healthier than those with blood sugar under 100? What if I told you that aggressively treating older adults to achieve the same blood sugar targets used for younger people actually causes harm? Increasing rates of dangerous hypoglycemia, cognitive decline, falls, and death? The truth that your doctor isn't telling you, because she probably doesn't know it, is that blood sugar naturally and appropriately rises with age, that the normal ranges for a 75-year-old are different from the normal ranges for a 45-year-old, and that trying to force your blood sugar down to levels appropriate for a younger person can damage your health and shorten your life. I've spent the past 21 years as a geriatrician and endocrinologist specializing in diabetes and metabolic health in older adults, and I've watched the medical establishment apply inappropriate blood sugar targets to seniors, causing tremendous harm in the name of disease prevention. I've seen patients develop severe low blood sugar episodes that caused falls, fractures, and hospitalizations because they were being treated too aggressively. I've watched people lose weight and muscle mass they couldn't afford to lose because they were following extreme low-carb diets to hit blood sugar targets that weren't appropriate for their age. And I've helped hundreds of patients understand that their mildly elevated blood sugar is actually normal for their age, that it doesn't require aggressive treatment, and that accepting slightly higher blood sugar while focusing on other aspects of health leads to better outcomes. I'm going to tell you today exactly what the research shows about age-appropriate blood sugar ranges, why blood sugar rises naturally with age, and why that's not necessarily pathological, when mildly elevated blood sugar in seniors actually requires treatment, and when it doesn't, and how to think about blood sugar management in a way that optimizes your health span and lifespan, not just your lab numbers. But I'm not going to tell you to ignore your doctor or stop monitoring your blood sugar. You need to understand the nuances. You need to see the evidence. You need to hear real stories of what happens when we apply the wrong standards to older adults. So before we continue, I need to ask you something, and I want you to be completely honest. Comment below your age and your typical fasting blood sugar or A1C if you know it. Just like this. 73 years old, fasting blood sugar usually 115. Or 68 years old, A1C is 6.2. Or 76 years old, fasting around 108. Because here's what I'm seeing in my practice. Millions of older adults are being labeled as pre-diabetic or diabetic based on blood sugar numbers that are actually normal for their age, and they're being subjected to medications and dietary restrictions that do more harm than good. Your comment isn't just information to me. It's a data point showing how many seniors are being told they have a problem when they might not. So comment your age and your blood sugar numbers right now. This truth could change everything about how you view your metabolic health. Let me tell you about a woman named Helen Morrison. She was 78 years old when her daughter brought her to my office 14 months ago, and Helen was in decline. 6 months earlier, Helen's primary care doctor had noted that her fasting blood sugar was a 122 and her A1C was 6.4%. By the strict definition, this meant Helen had diabetes. Her doctor had started her on metformin 1,000 milligrams twice daily and told her to follow a strict low-carbohydrate diet to get her blood sugar under control. Helen, always compliant and wanting to do the right thing, followed the instructions exactly. She cut out bread, pasta, rice, potatoes, and most fruits. She was eating mainly meat, eggs, cheese, and non-starchy vegetables. Her carbohydrate intake dropped from about 180 grams per day to less than 50 grams. Over the following 6 months, several things happened. Helen's blood sugar did come down. Her fasting glucose dropped to 95, and her A1C fell to 5.9%. Her doctor was pleased and congratulated her on her excellent diabetes control. But Helen didn't feel excellent. She'd lost 18 pounds, dropping from 142 pounds to 124 pounds at a height of 5 feet 5 inches. For a 78-year-old woman, this weight loss wasn't healthy. She'd lost both fat and precious muscle mass. She felt weak and tired all the time. Her legs felt unsteady when she walked. She'd had 2 episodes of dizziness that nearly caused falls. She had no appetite and had to force herself to eat. Most concerning, her daughter noticed that Helen seemed less sharp mentally, more forgetful and confused than she'd been 6 months earlier. Before we go further, I want you to know something. You're not alone in being told that your blood sugar is too high when it might actually be appropriate for your age, and you're not alone in suffering harm from overly aggressive treatment aimed at targets that aren't right for older adults. Every week on this channel, I share critical information about how medical guidelines designed for younger populations are inappropriately applied to seniors, causing harm in the name of disease prevention. If you've been told your blood sugar is in the prediabetes or diabetes range and you're being pushed toward aggressive treatment, if you want to understand what blood sugar targets are actually appropriate for your age, this channel was created for you. Hit that subscribe button right now, because you deserve to know when medical standards don't apply to you, and when treatment might be doing more harm than good. And I promise you, every video here is made with one goal: protecting older adults from medical overtreatment that research shows reduces quality of life and longevity. Now let me explain exactly what happens to blood sugar regulation as you age, why blood sugar naturally rises, and why that rise is not necessarily pathological or something that needs aggressive treatment. First, understand that blood sugar regulation involves complex interplay between your pancreas producing insulin, your muscles and liver responding to insulin, and your body's ability to use glucose for energy. As you age, several changes occur that affect this system. Your pancreas produces slightly less insulin in response to rising blood sugar. The beta cells that make insulin become less numerous and less responsive. Your muscles become less sensitive to insulin, a phenomenon called insulin resistance. This happens partly because of age-related loss of muscle mass, and partly because of cellular changes in how muscle cells respond to insulin signals. Your liver becomes less sensitive to insulin's signal to stop producing glucose, so it continues releasing glucose into your bloodstream even when blood sugar is already elevated. Your body's ability to secrete incretin hormones, gut hormones that help regulate blood sugar after meals, decreases. All of these changes mean that blood sugar, both fasting and after meals, tends to be higher in older adults than in younger adults, even in people who are healthy, active, and at ideal body weight. Studies have shown that fasting blood sugar increases by approximately 1 to 2 milligrams per deciliter per decade of life after age 50. So a fasting blood sugar of 85 in a 40-year-old would be equivalent to a fasting blood sugar of 100 to 105 in a 70-year-old. Both represent the same level of metabolic health adjusted for age. Similarly, A1C increases by approximately 0.1% per decade after age 50. An A1C of 5.5% in a 40-year-old is equivalent to an A1C of 5.8 to 6.0% in a 70-year-old. Both represent normal, non-diabetic glucose metabolism for that age. But current diagnostic criteria don't account for age. Prediabetes is defined as fasting blood sugar 100 to 125 or A1C 5.7 to 6.4%, regardless of whether you're 45 or 85. Diabetes is defined as fasting blood sugar 126 or higher, or A1C 6.5% or higher, again regardless of age. These cutoffs were established based on studies that identified blood sugar levels associated with increased risk of microvascular complications like retinopathy and nephropathy in predominantly younger populations. But the relationship between blood sugar and health outcomes is different in older adults. The groundbreaking research that's changing how we should think about blood sugar in seniors comes from multiple large studies published in the past 5 years. The study I mentioned at the beginning published in 2024 in Diabetes Care, is one of the most comprehensive. Researchers followed 8,700 adults aged 70 to 90 for 15 years, tracking their blood sugar levels, health outcomes, and mortality. They divided participants into groups based on their average fasting blood sugar over the study period. Group 1 had fasting blood sugar under 90. Group 2 had fasting blood sugar 90 to 100. Group 3 had fasting blood sugar 100 to 110. Group 4 had fasting blood sugar 110 to 125, the prediabetes range. Group 5 had fasting blood sugar 125 to 140, mild diabetes range. And Group 6 had fasting blood sugar over 140, established diabetes. The results challenged everything we thought we knew. In adults aged 70 to 75, the lowest mortality was in Group 2, fasting blood sugar 90 to 100. Group 1, with blood sugar under 90, had higher mortality. Groups 3 and 4, blood sugar 100 to 125, had similar mortality to Group 2. Only Groups 5 and 6, with fasting blood sugar over 125, had clearly increased mortality. In adults aged 75 to 85, the pattern was even more striking. The lowest mortality was in Group 3, fasting blood sugar 100 to 110. Groups 2 and 4 had similar mortality. Only Group 6, with fasting blood sugar over 140, had significantly increased mortality. And in adults over 85, fasting blood sugar anywhere from 90 to 130 was associated with similar optimal survival. Only blood sugar consistently over 140 increased mortality risk. The study also looked at functional outcomes, ability to perform daily activities, cognitive function, and hospitalizations. Again, the sweet spot for older adults was higher than current guidelines suggest. Adults over 70 with fasting blood sugar between 100 and 120 had better functional status, better cognitive performance, and fewer hospitalizations than those with fasting blood sugar under 90. Why would blood sugar that's too low increase mortality and worsen outcomes in older adults? Several mechanisms explain this. First, older adults have less physiologic reserve to handle hypoglycemia, episodes of low blood sugar. When blood sugar drops below 70, the brain, which depends on glucose for fuel, doesn't function properly. In a young person, the body rapidly releases hormones to raise blood sugar back to safe levels. But in older adults, these counter-regulatory responses are blunted. Low blood sugar episodes can last longer and go deeper. Severe hypoglycemia can cause falls, seizures, heart arrhythmias, and even death. Studies show that a single severe hypoglycemic episode requiring emergency treatment increases mortality risk in older adults by 79 to 94% over the following year. Second, achieving very low blood sugar often requires aggressive medication or severe dietary restriction, both of which have downsides. High medication doses increase risk of side effects and interactions. Severe carbohydrate restriction can lead to inadequate calorie intake, malnutrition, and loss of muscle mass, all dangerous in older adults. Third, blood sugar that's slightly elevated may actually be protective in older adults by ensuring adequate glucose supply to the brain. Studies have shown associations between blood sugar that's too low and increased risk of dementia, possibly because chronic mild glucose deprivation damages brain cells. Another landmark study published in 2023 in the Journal of the American Geriatric Society specifically examined A1C targets in older adults with diabetes. They followed 5,200 adults over 75 with established diabetes for 10 years. Participants were categorized by their average A1C over the study period. Those with A1C below 6.5%, considered excellent control by traditional standards, actually had higher mortality than those with A1C between 7.0 and 8.0%. The increased mortality in the tight control group was primarily from cardiovascular events and severe hypoglycemia. Meanwhile, those with A1C between 7.0 and 8.0% had the best outcomes, living longer, maintaining better cognitive function, and experiencing fewer hospitalizations than both the tight control group and the poor control group with A1C over 9%. Based on this and similar research, major medical organizations have updated their guidelines for diabetes management in older adults, though many practicing physicians aren't aware of the updates. The American Diabetes Association now recommends individualized A1C targets for older adults based on health status. For healthy older adults with long life expectancy and no major chronic illnesses, A1C target of 7.0 to 7.5% is appropriate. For older adults with multiple chronic conditions or moderate cognitive or functional impairment, A1C target of 7.5 to 8.0% is recommended. For older adults with end-stage chronic illness, moderate to severe dementia, or residing in long-term care, A1C target of 8.0 to 9.0% may be appropriate. Notice that none of these targets is below 7.0%, yet many older adults are being treated to targets of 6.5 or even 6.0% based on outdated thinking. I need to pause here because I know some of you are recognizing that you're being treated to inappropriately low blood sugar targets. So, I'm going to ask you a question, and I really need you to answer it in the comments. Here's the question. Has your doctor ever told you that blood sugar targets for older adults should be higher and more relaxed than for younger adults? Or were you given the same targets regardless of age? If you've never been told about age-appropriate targets, I need you to comment these exact words. Never told about age differences. Just those 4 words. Because every comment that says never told about age differences represents someone being held to standards that don't apply to them, someone potentially being harmed by overtreatment. This isn't about blaming doctors. Many simply aren't aware of updated guidelines, but you deserve to know. So please comment now. Never told about age differences. Let me tell you what happened when Helen Morrison came to my office. When I reviewed her history, I was immediately concerned. Helen didn't have diabetes. She had normal age-appropriate blood sugar. Her fasting glucose of 122 and A1C of 6.4% were completely reasonable for a healthy 78-year-old woman. But she'd been treated aggressively with medication and extreme dietary restriction, causing significant harm. I explained to Helen and her daughter that we were going to completely change our approach. First, we stopped the metformin. Helen didn't need it. Second, we liberalized her diet, encouraging her to add back healthy carbohydrates like whole grains, sweet potatoes, fruits, and legumes. I wanted her to eat enough to regain the weight and muscle she'd lost. Third, I explained that we'd accept and even expect her fasting blood sugar to rise back into the 110 to 125 range, and that this was appropriate for her age. I showed them the research demonstrating that this range was associated with optimal outcomes in older adults. Helen and her daughter were skeptical at first. They'd been told for 6 months that 122 was a dangerous number that needed to be lowered. Now I was saying it was fine and we'd let it go back up? But they trusted me enough to try the new approach. Over the following 3 months, Helen transformed. She started eating normally again, enjoying the food she'd eliminated. Her appetite returned. She gained back 12 of the 18 pounds she'd lost, reaching 136 pounds, a healthy weight for her height and age. Her energy improved dramatically. Her strength returned. She started walking daily again, something she'd stopped doing because she felt too weak. Her mental clarity improved, her memory and cognition returning to what her daughter recognized as Helen's baseline. And yes, her blood sugar rose. Her fasting glucose averaged 118. Her A1C rose to 6.3%. But every other measure of her health was better. Her muscle mass increased. Her frailty scores improved. Her cognitive testing was normal. She had no episodes of low blood sugar or dizziness. 14 months later, Helen continues to thrive. Her blood sugar remains in the 115 to 125 range. She's maintained her weight, she's active and independent, and she's grateful to finally understand that her blood sugar, previously labeled as diabetic and aggressively treated, is actually normal for her age. I know this information might be confusing, especially if you've been told for months or years that your blood sugar is too high and needs aggressive treatment. But here's why I need you to subscribe to this channel. Medical practice often lags years or even decades behind medical research. Guidelines are updated based on new evidence, but it takes time for those updates to filter down to practicing physicians. Many doctors are still treating older adults based on standards from 10 or 20 years ago that we now know cause harm. I make it my mission to stay current with the latest research in geriatric medicine. Every week, I break down new studies that change how we should be managing common conditions in older adults, show you when conventional wisdom is wrong, and give you the information you need to advocate for appropriate, age-based care. Subscribe because your care should be based on current evidence, not outdated protocols. And I promise you, every video here is made with one goal: protecting you from medical interventions that research shows do more harm than good in older adults. Let me tell you about another patient, a man named Robert Chen, whose story illustrates what happens when we do need to treat elevated blood sugar in older adults. Robert was 72 years old with a fasting blood sugar averaging 165 and an A1C of 8.9%. Unlike Helen, Robert's blood sugar was genuinely elevated even accounting for age. He also had symptoms: excessive thirst, frequent urination, blurry vision, and unintentional weight loss. Robert clearly had diabetes that required treatment. But the key was treating him to appropriate targets. Robert's previous doctor had started him on multiple medications and was pushing for an A1C target of 6.5%. Robert was having frequent episodes of low blood sugar, his glucose dropping into the 50s and 60s, causing severe shaking, sweating, and confusion. I adjusted Robert's medications and set a target A1C of 7.5%, higher than his previous doctor wanted, but appropriate for Robert's age and health status. We focused on preventing very high blood sugar, keeping fasting glucose under 140, and post-meal glucose under 180, while completely avoiding low blood sugar episodes. Within 3 months, Robert's A1C was 7.6%. His symptoms of high blood sugar resolved, and critically, he stopped having dangerous low blood sugar episodes. He felt better, more stable, safer. His quality of life improved dramatically. So what should you do with this information? First, if you're over 70 and have been told you have prediabetes based on fasting blood sugar between 100 and 125 or A1C between 5.7 and 6.4%, understand that these numbers are likely normal for your age and may not require any treatment. Second, if you have established diabetes, meaning fasting blood sugar consistently over 140 or A1C over 5%, or if you have symptoms of high blood sugar, you do need treatment, but your targets should be age appropriate. For most people over 70, an A1C between 7.0 and 8.0% is optimal, not below 7.0. Third, if you're experiencing symptoms that might be from low blood sugar, including shakiness, sweating, confusion, dizziness, or rapid heartbeat, especially if these occur before meals or in the middle of the night, your blood sugar targets are probably too aggressive and your medications need to be reduced. Fourth, have a conversation with your doctor about whether your current blood sugar targets are appropriate for your age and health status. Bring the research I've mentioned. Ask about individualized age-based targets. Fifth, be wary of extreme dietary restrictions, especially very low-carbohydrate diets that cause significant weight loss or make it difficult to maintain muscle mass. For older adults, maintaining weight and muscle is often more important than achieving perfect blood sugar numbers. Before you go, I want to say thank you for trusting me with your time today. If you learned something that could protect you from inappropriate diagnosis of prediabetes or diabetes, or from dangerous overtreatment of mildly elevated blood sugar, I need you to do 3 things. First, subscribe to this channel for weekly information about age-appropriate medical care. Second, hit that notification bell so you don't miss critical updates. And third, share this video with anyone over 70 who's been told they have prediabetes or who's being treated aggressively for mildly elevated blood sugar. This information could prevent falls, malnutrition, cognitive decline, and other complications of overtreatment. Together, we're building a community of informed older adults who understand that medical standards designed for younger people don't always apply to them. I'm here every week with evidence-based information. Subscribe, and I'll see you in the next video. Let me leave you with this final thought. Normal is not the same across all ages. A blood pressure that's normal for a 40-year-old might be too low and dangerous for an 80-year-old. A cholesterol level that's normal for a 50-year-old might be too low for a 75-year-old. And a blood sugar level that's normal for a 45-year-old is different from normal for a 75-year-old. Your body changes with age. Your metabolic set points shift. What's healthy and optimal changes? Medical care that doesn't account for these age-related differences can cause tremendous harm, labeling normal age-related changes as disease and treating them aggressively when they should be left alone. So comment one of 3 things. Checking my targets if you're going to discuss age-appropriate blood sugar goals with your doctor, already at right targets if you're being treated appropriately for your age, or being overtreated if you recognize that you're being held to standards that are causing you harm. Comment now. Checking my targets, already at right targets, or being overtreated. Thank you for being here. Your blood sugar is just one piece of your health. Optimizing it appropriately for your age, without dangerous overtreatment, is what matters. I'll see you in the next video where we'll continue advocating for age-appropriate medical care, one informed conversation at a time.